Why some patients still get cavities despite brushing and flossing. The real role of diet in tooth decay. Dentists and hygienists know this story well. The teenager who brushes twice a day but keeps racking up cavities, while the patient who barely flosses somehow walks away decay-free. It feels unfair, but the explanation is simple. Brushing, flossing, and fluoride help, but diet is the real driver of tooth decay. Caries is not spontaneous. Bacteria need fermentable carbohydrates to produce acids, and without those carbs, no acid is made. The worst offenders are not always candy or soda, but the starchy, sticky snacks that hang around on teeth. Crackers and pretzels often cause more damage than ice cream. Frequency matters more than volume. A daily dessert is less harmful than grazing on healthy snacks from morning to night. Dentists also see how age and occlusion change the equation. Adults usually clear food better while chewing, but kids with erupting molars have deep grooves that trap carbs. One barely erupted molar can become a lone battlefield of decay. Then there are the acidic culprits that bypass bacteria altogether. GERD, citrus habits, sodas, and energy drinks can erode enamel directly. The message to patients does not need to be no carbs ever. That will never stick. Get the pun? What does work is helping them manage their exposure time. Controlled snack times, rinsing with water, chewing sugar-free gum, or brushing after sticky foods can all help. Even a quick rinse when brushing is not an option reduces damage. As one townie put it, you cannot outbrush a bad diet. Fluoride still matters. Research consistently shows that it protects teeth in a sugar-rich environment. Dr. Philip Hujol has pointed out that fluoride becomes less essential when carbohydrates are minimized. The science has been clear for decades. McCollum's 1941 Nature paper already tied dental caries to dietary carbohydrates. The Swedish Vipholm study later confirmed that sugar between meals caused the worst decay, while sugar at mealtimes was less destructive. For practical advice, keep it simple. Tell patients to snack less often. Avoid sticky starches. Pair acidic foods with neutralizers like cheese. Brush with fluoride toothpaste. And when you deliver the message, frame it with respect. A gentle, "Would you like to hear what could cut down on your cavities?" is better than a lecture. Patients are more likely to listen when they feel included rather than judged. At the end of the day, fluoride, brushing, and flossing build resilience, but diet decides who spends their life with intact teeth and who ends up back in your chair for another restoration. When a patient insists they brush and floss daily, yet still show new decay, how do you bring diet into the conversation in a way that gets through without making them feel scolded? You can read more on the message boards at Dentaltown. Have a great day.